haven't we been told many times before? I've said it many times here. We have to follow the science, right? Follow the science, follow the science. Listen to the experts, listen to the experts. Until the experts say things that doesn't work for the Democrat narrative. Today, the World Health Organization has announced that, lockdowns might not be the best way to fight COVID-19. This at the time, remember, Joe Biden said, if the experts say we got to lock down, then I'm going to listen to the experts. Why hasn't Trump called for a national lockdown, even though we're like 7-8 months into the coronavirus? The president doesn't care about people's lives. Now we have the World Health Organization saying that perhaps this could have been more problematic than any of the good that it did.
We in the World Health Organization.
The doctor's name is David Nabarro. David Nabarro, there it is.
Do not advocate lockdowns as a primary means of control of this
Whoa,
virus.
did you hear that? I'm going to rewind that. Listen to that again. This is stunning.
Really important point by Professor Gupta. I want to say it again. We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it. Just look at what's happened to the tourism industry, for example, in the Caribbean or in the Pacific, because people aren't taking their holidays. Look what's happened to smallholder farmers all over the world because their markets have got dented.
Wow.
Look what's happening to poverty levels. It seems that we may well have a doubling of world poverty by next year. We may well have at least a doubling of child malnutrition because children are not getting meals at school. And
this is stunning stuff. Did you hear this? But remember, we were told that if we mentioned anything about the economic ramifications of lockdowns, if we mentioned the mental toll of lockdowns, the increase in depression and drug use and alcoholism and suicides, if we mention any of those things, we are the ones that are uncaring. We are the ones that are now COVID-19 deniers. The World Health Organization finally is saying the obvious, that lockdowns have been more bad than good.
Their parents in poor families are not able to afford it. This is a terrible, ghastly global catastrophe, actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method.
My God.
Develop better systems for doing it. Work together and learn from each other. But remember, lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
Whoa, that is stunning. That is absolutely stunning. Now, I want to see whether Twitter is going to take down that video. I want to see whether Instagram is going to take down video, because this is a representative. This is a spokesperson, a doctor from the World Health Organization speaking for the World Health Organization. Lockdowns have contributed to people dying. Lockdowns have made people poorer. Lockdowns have had a disgusting effect on people's mental health. Now you see why this election is so consequential. Many of Joe Biden's advisors want to continue the lockdowns. Here in New York, Andrew Cuomo has announced, guess what? More lockdowns. When will it all end? What the media is not telling you is, yes, we've had more cases go up. Yes, that's true. More cases, but we have not seen an increase in the death rates. That's what the facts and that's what the science says. Do you think we can handle as a country another lockdown? A lockdown that is not based off of the scientific facts and evidence. Can we afford that? I don't think so.